Enhanced recovery after surgery is a fundamental remapping of the way that our patients and providers interact with one another regarding the surgical experience. It's really about engaging the patients in a way that help them understand the role that they play in the surgical process, taking things that are meaningful about our health and wellness and applying those in the surgical setting. Our patients are the most important thing to us, and what we want is for them to have a surgical experience where they come out feeling better than they did before the surgery.
Meet Susan Stein, who comes to VCU Health System for bilateral hip replacement surgery.
So I'm going to ask a lot of questions today.
This morning, Susan will meet with different members of the medical team who will assess her readiness for surgery, address risk factors,
Your hemoglobin and hematocrit were all fine, you're not anemic.
and prepare a plan to optimize her health before her surgery. Once the plan is set, the provider teaches Susan about the things she will need to do in the days leading up to surgery. Susan will use an incentive spirometer to improve her lung function and determine what her breathing goal should be after surgery. She will be instructed on a 5-day decolonization regimen that aids in the prevention of a surgical site infection. And she will receive a special carbohydrate drink mix to provide her body with fuel for the surgery and ensure she's not dehydrated. Susan leaves the PACE clinic with all the instructions and supplies she needs to arrive fit and ready on the morning of surgery. Meet Mr. Frank Elliott, who comes to the VCU Health System for total right knee replacement surgery. He had his left knee replaced successfully using the ERAS protocol at VCU 3 months ago, and he's chosen to have his right knee replaced using the same approach. Mr. Elliott is getting prepared for surgery in the preoperative area. He will receive some of the medications used for our multimodal preemptive pain management approach.
So 975 milligrams of Tylenol, 300 milligrams of gabapentin, and 200 of Celebrex. And the purpose of giving you all 3 of those beforehand is to just help with pain afterwards and hopefully limit the amount of opioids we're giving you and get you out of bed sooner, okay?
He has been allowed to consume a clear carbohydrate-rich fluid up until 2 hours prior to surgery. Next, Mr. Elliott meets with an anesthesia team member to discuss the regional anesthesia he will receive. Regional anesthesia is strongly preferred with the ERAS protocol. This typically includes a spinal or combined spinal epidural anesthetic and may include a nerve block in the thigh above the knee replacement site to dramatically lessen postoperative pain. In the operating room, Mr. Elliott will rest on a comfortable operating table with a spinal anesthetic, oxygen, and appropriate anesthesia monitoring for blood pressure, oxygen level, and temperature. He will receive sedation if needed. Once Mr. Elliott is fully prepped and draped for the surgery and in final position, the surgery is performed with the use of a tourniquet to reduce bleeding. The procedure will take approximately 1 hour. In the recovery room, Mr. Elliott is monitored and we allow the spinal anesthetic to wear off. He is awake, alert, and comfortable, and is even allowed to have a protein shake for nourishment. On the orthopedic floor, Mr. Elliott is receiving appropriate multimodal pain medicine, and he will walk with a walker a short distance several hours after the surgery was completed.
Lots of pain?
No pain.
Okay.
This has been shown to expedite progress and reduce complications associated with bed rest. We are now on the first postoperative day, and Mr. Elliott has undergone physical therapy.
Good job.
And he has been found to be safe for discharge. He has been instructed to take Tylenol every 6 to 8 hours for the first week after surgery, and is given a limited number of pain pills to take only if needed for breakthrough pain. He will go home with limited home care services for recovery, and will follow up in clinic with Dr. Cates in 2 weeks.
Enhanced recovery after surgery, or ERAS in shorthand, is an international initiative to improve perioperative care and continuity of care for surgical patients. We at VCU are at the forefront of that initiative, and it's resulted in superior patient outcomes as well as enhanced patient satisfaction. We're very proud of the work that we're doing here at VCU, leading the way in such an important initiative as ERAS.